Hi, my name is Professor Bonaca. I'm giving this presentation from the United States, Colorado, at the University of Colorado. It's really a pleasure to present these data at ESC 2020, and it's an honor to present this data on behalf of the THEMIS trial, executive committee, steering committee, and all the patients that consented to be in the trial. This presentation is titled Risk of Limb Events and the Effect of Ticagrelor in Patients with and Without Peripheral Artery Disease. These are my disclosures. The THEMIS trial demonstrated that the combination of ticagrelor and aspirin versus aspirin alone reduced major adverse cardiovascular events in patients with diabetes and coronary disease, but no prior MI or stroke. And there was no heterogeneity amongst those with and without peripheral artery disease. There was an increase in bleeding, which is shown on this slide, and this is the overall results in the trial. And again, the effects on bleeding were consistent in those with and without peripheral artery disease. Now, diabetes is recognized to be a major risk factor for adverse limb events. In fact, when you look at trials of patients with peripheral artery disease, like the Euclid trial here, you can see that those in the orange bar, those with concomitant diabetes, are much higher risk of amputation and limb events versus those even in a background of PAD. And it's more important as a predictor than polyvascular disease, actually, for limb events. So diabetes is a potent risk factor. And you see this not only in trials, but in real world data sets, like this premier registry analysis by Connie Hess of almost 400,000 patients. And you can see in the red bar versus the yellow that the addition of diabetes to peripheral artery disease is a potent marker for all forms of adverse limb outcomes, including amputation and acute limb ischemia. The objectives of this analysis were really to characterize the spectrum of limb ischemic events in those patients with diabetes and coronary artery disease overall, and then with and without PAD. And we looked at a spectrum of events: acute limb ischemia, the STEMI equivalent of the leg, major amputation of vascular etiology, and peripheral revascularization. We then did a composite of those three outcomes and call that overall limb ischemic outcomes. We wanted to look at the effect of ticagrelor plus aspirin versus aspirin alone on these events, and to see if those effects were consistent in those with and without peripheral artery disease. Now, THEMIS was a large multinational randomized trial, one of the largest ever in diabetes. Patients had to have coronary disease, but no prior MI or stroke. And of course, patients at high risk of bleeding were excluded. Sites reported limb ischemic events and major adverse limb events: acute limb ischemia, major amputation of a vascular etiology. Their definitions here on the slide were prospectively collected and adjudicated using established definitions at CPC Clinical Research here in Colorado. And the need for peripheral revascularization was investigator reported. Now, here are the baseline characteristics. Just to orient you, I'm showing you baseline characteristics in those with concomitant peripheral artery disease in the red and those without in the black, okay? And you can see that patients with peripheral artery disease are different. All these p-values are quite significant with the exception of diabetes complications. Patients tended to be older, more commonly smoking, more dyslipidemia, more hypertension. They had a longer duration of diabetes, and more often had renal dysfunction. So a higher risk group with PAD than without. So now if we take the placebo group of the THEMIS trial, we look at outcomes in those with PAD in red and those without PAD in gray. Remember, all patients have diabetes and coronary disease. So here we're talking about concomitant PAD. What's the effect overall in outcomes? Well, you can see in spite of them all having CAD and diabetes, if you add PAD, there's a much higher risk of MACE, almost a 50% increase, and a large increase in mortality, and much of that both cardiovascular and non-cardiovascular. So a higher risk subgroup. These are unadjusted, but this is what you would observe in the clinic if somebody came in with these risk factors. And then importantly, by definition, by the basis of their disease, those patients with lower extremity PAD were at much higher risk of adverse limb outcomes, almost a 10-fold risk of limb ischemic events on the left, and then you see the components laid out on the right, the most common being peripheral revascularization for symptoms of ischemia, and then amputation and acute limb ischemia. But all of these significantly increased with concomitant PAD, even on top of diabetes and coronary disease. Now, what's the effect of ticagrelor versus placebo? Well, here you see the overall effect in the overall population. Now, most patients didn't have PADs. The event rates appear to be low, but this was the primary analysis. And you can see that there's a significant 23% reduction in limb ischemic events overall with ticagrelor versus placebo. Now, if we take a closer look, I'm showing you the same data at the far left. Again, this is the overall population limb ischemic events. And now if we look at the components of that, again, the most frequent is the need for peripheral revascularization. We see a 20% significant reduction in the need for peripheral revascularization. And we see consistent effects for acute limb ischemia and major amputation, with a particularly profound effect there for acute limb ischemia and a consistent trend for major amputation. So we see consistency amongst all of these components of adverse limb outcomes in the overall population. Now, peripheral revascularization is something that is done for multiple reasons. Here we stratified the peripheral revascularizations for elective, so one that might come in for claudication, for example, and non-elective, patients that may need revascularization for critical limb ischemia or threatened tissue loss. And what you see here is, again, the significant reduction in peripheral revascularization. And when we stratify it by the reason, interestingly, we see consistency both for elective and non-elective, and suggesting that not only are we modifying thrombotically mediated events, so it's at the far right, but also for elective, we see a trend for benefit with ticagrelor. Now, the next question that we asked was the benefit consistent in those with and without peripheral artery disease? At the far left of this slide, I'm showing you the overall benefit in the overall population, so limb ischemic events in all 19,000 patients. We see the 23% reduction there. As we move to the right of the slide, now we've stratified that by the presence of peripheral artery disease. As we saw initially, those that had PAD are much higher risk of limb events. You see that here in the black bars. If you have PAD versus no PAD, you are at a much higher risk of adverse limb events. And when we look at the effect of ticagrelor, we actually see that there's a consistent benefit. Whether or not you have peripheral artery disease, there's no heterogeneity. The interaction term here of 0.81 is not significant. Yet the absolute benefit is particularly large in those with PAD because their baseline risk is so high. And so here we see an absolute reduction of almost 2%. So to summarize, among patients with diabetes and coronary disease, those that have known PAD are at very high risk of limb events, almost a 10-fold increase versus those that do not, even in spite of their known athero and diabetes. PAD is an important predictor. In patients enrolled in THEMIS, ticagrelor reduced limb ischemic events. This included about a 50% reduction in the major adverse limb events. We define those as acute limb ischemia or major amputation of a vascular etiology, and a 20% reduction in the need for peripheral revascularization. We saw a consistent trend just for elective. These benefits were consistent regardless of PAD status at baseline. But of course, because the risk is so high in those with PAD, the absolute benefit was greater, an almost 2% reduction over the course of the trial. To conclude here, these findings really suggest that concomitant PAD and diabetes and coronary disease, when you identify that's an important marker of limb outcomes, and it may identify a population that gets particular benefit from long-term ticagrelor, because not only do they get the MACE benefit, but a large limb benefit. When you put this data together with those from Pegasus TIMI 54, they further support the role of ticagrelor for the reduction of adverse limb events. But a word for future study, that really to understand the effect of the strategy in patients selected on the basis of PAD, and particularly the efficacy and safety after something like peripheral intervention, dedicated trials will be necessary to understand that. Thank you very much for the opportunity to present these data. This is my presentation. Thank you.